So why advanced access? Well, the short answer is family. I'm a family physician and I love my work. However, it's just my job. It's not my life. And this is my life. I've got a lovely family and I like to spend time with them. And I need to free up time to spend time with them. I've got 4 associates. Well, there are 4 of us that are associates in our office. 3 of them are all older than me. They've all got grown children who are teenagers or older at university. And they all say to me, Mark, spend more time with your kids. Okay, make sure you spend more time with your kids. And this is one of the driving forces behind me getting involved in CPR and advanced access, to be able to free up time to spend with my family. Quality of life is really important to me. Family values are really important to me. And love to spend quality time with my family. Okay, any guesses where this is? This is on my beef ranch in South Africa. And the reason why I put the slide in was to show how there is life outside of medicine. And I also happen to be a beef farmer back in South Africa. And I think that because of my farm, this is where I grew up, by the way. I think that from my farming background and the work ethic that I learned growing up on the farm, a couple of catchphrases when I first saw the concept of advanced access caught my attention. Keeping things simple, keeping systems simple. All weights are bad. These are the kind of things that my dad used to teach me on the farm when I was a kid, and so I could relate to them when I saw them for the first time. Doing today's work today. Okay, that's another concept which I grew up with. I said I like to spend time with my family. I also like I enjoy anything on water, whether it's fishing or boating or downhill skiing, even on frozen water, right? I have you know that I have learned how to ski. I didn't ski in South Africa when I was a kid, but I have learned how to ski and I thoroughly enjoy it. I make sure that we go every year with my kids, and we go and enjoy that. What came to mind when I saw this picture, though, was boot camp. I don't know if you guys, how familiar you guys are with advanced access. Can everybody just stick up their hand if they know the process of how you get there? Okay. Sorry, I was under the impression that everybody knew what advanced access was and how it worked. You have to go through a process called boot camp, which I'll touch on a little bit later. I'll explain to you how it works. And it's essentially like going down a rapid on a raft. You've just got to keep paddling and going until you're through it. Because if you don't, you might just get sucked under, or you might be in severe trouble, you might drown. Okay, you've got to keep going with boot camp. Okay, and this is my son and I at Fernie earlier this year, and as I said, we really enjoy the skiing experience and family time. Okay, I had said to Christina that I kind of wanted to change my presentation a bit, but it was too late to change the slides. But I thought that what I'd like to do is I'd like to give you an overview of how my practice functions before I go into the actual change that happened in my practice in the last 2 years, because it'll help you to better understand why things happened. In terms of my practice, I have 2,500 patients, more or less, and that's active patients. That's based on people who I've seen in the last 2 years. Okay, there's several hundred out there who still consider themselves to be my patients, and I would still see if they came back, but they kind of have been doing the walk-in clinic circuit and stuff. There's a bit of a flux in Moose Jaw of clients who go between different offices, and there's a good reason for that, and I'll touch on that later. But anyway, 2,500 people. My main love is pediatrics. I absolutely love pediatrics, and I would have been a pediatrician before I came to Saskatchewan and met my wife and got stuck here. And I'm not sorry that I stayed. I really love what I do now. Anyway, pediatrics is my main interest. I do obstetrics. I deliver about 100 babies a year. For those of you who are good at math, you'll figure out that that's about 2 a week. And for those of you who are even better at math, you'll figure out that approximately once every second week I have to cancel a day or part of a day of my office to go and deliver a baby, because 40 hours, 160 hours, right? 1 in 4, okay. Babies will be born during my regular office hours. I work from 9 to approximately 4 o'clock Monday through Thursday and Friday mornings. That's my regular office hours. I am what you would call a full-service family physician, which means that I look after my own patients in the hospital. I deliver babies. I take part in on-call. I do some work in emergency. I used to work emergency room shifts all the time. Now I'm kind of on the casual list because things got a bit busy. I do operating room assists. I see long-term care patients. I do on-call at Valley View Center, which is a home for handicapped people in Moose Jaw. So there's quite a lot that goes on, and you know what, it's great. Actually, I don't want to insult too many people, but just basic office practice where you're seeing people from morning to evening is actually pretty boring. So that's why you've got to do all these other things in order to really get the satisfaction, in my opinion. Taking nothing away from everybody else, but that's just the way I feel. So before I started Advanced Access, I was working with a receptionist slash office manager slash medical office assistant. I had Debbie who did everything, and the two of us were a team. It was really hard work. We were often swamped. We often worked really late because I had a policy, because I was interested in pediatrics. If somebody called and they were sick and their kid was sick, they had to be fit in the same day. That was not negotiable. And I needed the capacity to be able to do that. And so I was operating on in terms of it's called a carved out model, where basically what you do is that you got your day booked about 90%, and you've got about 4 or 5 slots that are open to see your emergencies. And guess what happens? Your 4 or 5 slots get used to accommodate 20 or 30 people. Okay, and then what happens is that you just end up working much longer hours. It's more stressful, it's more tiring, and something's got to give in that whole process. So this is where I came across Advanced Access, and we made that change approximately 2 years ago. We got extra staff in to help. We now have a receptionist. Debbie's functioning more as my office manager slash MOA, and I have a receptionist who works the front desk. It works phenomenally well. Advanced Access is doing really, really well. People talk about the third next available appointment. That phrase doesn't get used in my office simply because it's a non-concept. It's always the same day, right? There's no such thing as the third next available being 2 or 3 days away. It just doesn't happen. Approximately 30 to 40% of my day is pre-booked, and as for those of you good at math, 60 to 70% is open for visits. Is it a walk-in clinic? No, it's not a walk-in clinic. What happens is that people call in the morning and get offered a same-day appointment. You try and encourage people to take a same-day appointment. Is it always a same-day appointment only system? No, it's not, and I'll get into that a little bit later. So it's not a question of, okay, you either come in today or you don't get an appointment, sorry, bye. It doesn't work like that, okay? So that's how we're functioning at the moment, and I can, I'm pleased to say that it's going a lot better. In terms of the hours, we were able to finish most days on time at 4 o'clock. Friday afternoons I'm off. You will notice that it's like, okay, a family doctor that finishes at 4 o'clock in Saskatchewan and takes Friday afternoons off. There is a very good reason why we do that, and that's about you. At times in Advanced Access, you have to have the ability to work a little bit harder when the demand for that arises, and that's my capacity. That extra hour at the end of the day, Monday to Thursday and Friday afternoons, is my extra capacity. So occasionally, I will be working into that time in terms of meeting that demand for appointments. So I hope everybody's kind of got a concept now of how we function. Okay, good. Okay, so in terms of the question asked was what is the role of the clinician in clinical practice redesign? Well, I think that for me what's really important is the concept of a team. So not so much necessarily the clinician, but forming a therapeutic team, and even in our practice team, it's just myself, my medical office assistant, and the receptionist. We're still a close-knit team, and I think the team concept is paramount to the success of a practice like this. You have to look at, you need to identify the need, and you need to look at the challenges of the old system. And from what I've told you guys already, you can tell that the carved-out model wasn't working for me. And the other thing that happened is that as my practice demographic changed over the last 10 years since I've been in family medicine, because I was interested in pediatrics and doing more pediatrics and maternity, suddenly the need for same-day appointments grew and grew and grew and grew, because there's more acute stuff going on in kids. That's just a fact. And so that was the other thing that made me identify that there was this need. So busyness, changing practice demographic, and the fact that there's just a fundamental flaw in the carved-out model. And I won't even talk about the congested model where you fully book for 2 weeks and you don't have any room for any capacity to take anybody. I mean, I don't know how that functions anymore. You know how we often say, how did we survive and how did we live before cell phones? Like, do you remember life before cell phones? How did we survive? Yeah, I mean, I don't know how I was able to practice with the congested model and then later the carved out model, which had kind of just come about through trial and error. I don't know how I did it.